So, hello friends, welcome to my new video. So, this is the last part on corneal transplantation where I will discuss with you all about keratoprosthesis. Okay. So, keratoprosthesis, which is also known as artificial cornea or KPRO, it is a surgical procedure which involves the implantation of synthetic corneal device to replace the damaged or diseased cornea. So it is typically considered or performed when traditional corneal transplantation like penetrating keratoplasty or endothelium keratoplasty are unlikely to success because of severe ocular surface disease or multiple graft failure or other complications. At that part, you will consider this keratoprosthesis. Okay. So these are the indications for keratoprosthesis or in short, KPRO. So here, keratoprosthesis may be considered for patients with severe dry eye, including Sjogren's syndrome, neurotrophic keratitis, chemical burn, Stevens-Johnson syndrome, other ocular cicatricial pemphigoid, and other conditions that result in poor ocular surface integrity. So these patients often have compromised tear film production and epithelium defect and chronic inflammation and making traditional corneal transplantation very challenging in this kind of cases. So their keratoprosthesis can be one option for those patients. Another like patient who have undergone multiple corneal transplantation or experienced uh, recurrent graft rejection, failure, or complication. So those patients may get benefit from keratoprosthesis. So the device provide a stable optical surface and reduce the risk of graft rejection associated with allogenic corneal tissue. So in where in all it is also performed in cases where corneal opacities are too dense or extensive to achieve satisfactory visual outcome with conventional transplantation techniques. So here keratoprosthesis offer an alternative option for visual rehabilitation. So the device provide a clear optical pathway for light to enter the eye, so improving the visual acuity. And here, patients with inflammatory or autoimmune diseases such as uh, autoimmune corneal health, recurrent corneal erosion, those patients may also get benefit from keratoprosthesis. So these conditions often lead to chronic inflammation and tissue destruction, making traditional corneal transplantation like the appendage keratoplasty are very much unsuccessful. So in those kind of patient keratoprosthesis can be one option for that. Here also traumatic injuries to the cornea resulting in extensive scarring or irregular astigmatism may also lead to very much challenging to treat with traditional corneal transplantation. So here keratoprosthesis can provide smooth and optical surface so that can improve the visual outcome in such cases. And also in case of congenital absence or partial absence of iris, that is known as aniridia, can lead to corneal opacity and visual impairment. So keratoprosthesis combined with iris reconstruction, this technique can improve the visual function in these patients. So here these are the types of keratoprosthesis. So there is basically three types of keratoprosthesis. I will start discussing one by one. Okay, so this is the first type of keratoprosthesis. This is Boston keratoprosthesis. So this Boston keratoprosthesis is also two types. So this Boston keratoprosthesis is a well-established and widely used artificial cornea, which is designed to restore the vision in individuals with corneal blindness or severe corneal disease. So the Boston keratoprosthesis comes in two main parts or two main types, right? Type 1 and type 2. Each type has specific feature and indication for use. So let's talk about type 1 Boston keratoprosthesis first, and then I will go to type 2 Boston keratoprosthesis. So here in this picture, this is the type 1 Boston keratoprosthesis. So here, if I take about the design of this Boston keratoprosthesis, so that this type 1 Boston K Pro consists of a front plate, back plate, and a locking ring. So here, I will show you the locking ring. So here in this picture, you can see this is the type 1 Boston keratoprosthesis where you can see that this is the front plate, this is the back plate, and this is the front plate, this is the back plate, this is the donor cornea, and this is the locking ring, so which is made up of titanium. Okay, so I was discussing with you all about type 1 Boston keratoprosthesis. So here this is the type 1 Boston keratoprosthesis, type 2 Boston keratoprosthesis. So let we complete this thing first and then I will come to this point. This is the front plate, this is the back plate, this is the locking knob which is made up of titanium, and here this is the donor cornea. Okay, so here you have seen it right now. So that type 1 Boston keratoprosthesis that was contained of this front plate, back plate, and the locking knob I already told you. So front plate is made up of clear medical grade polymethyl methacrylate or PMMA, while the back plate is made up of titanium, and the locking ring is also made up of titanium. So indications of this type 1 Boston keratoprosthesis here, this type 1 K-Pro is indicated for individuals with corneal blindness or severe corneal damage who have failed of traditional corneal transplantation surgery, that is penetrating keratoplasty, or are not suitable candidate for transplantation due to ocular surface disease or chemical injury or autoimmune disorder or multiple graft failure. So those patients are suitable for this type 1 Boston keratoprosthesis. Here, the procedure of surgery is, I would explain you, where during surgery, the damaged cornea is removed and the type 1 K-Pro is implanted and switched onto the eye. The front plate provides a clear optical surface to the light to enter the eye, while the back plate ensures stability and integration of the surrounding tissue. So if I tell about the advantages of this Type 1 K-Pro, is see this Type 1 K-Pro offer high optical quality, durability, and long-term stability. So it can provide significant visual improvement in patients with complex corneal conditions as well. So, patients who are receiving type 1 K-Pro require lifelong follow-up care to monitor the potential complications like infection, glaucoma, or other abnormalities. So, regular monitoring of intraocular pressure is very much important in this type of cases. So, let us move to this type 2 Boston keratoprosthesis. So, this is the type 2 Boston keratoprosthesis. So this the Type 2 K-Pro shares the same basic design as the Type 1 with a front plate, back plate, and locking ring. However, the Type 2 K-Pro feature modified the front plate design with a central stem, which allow the incorporation of the donor corneal nerve. So this Boston Type 2 keratoprosthesis is an artificial device which is used to replace the cornea in setting of disease with severe recurrent scarring, or which other types of corneal transplantation are not that much good option. So a complete tarsography is performed in the polymethyl methacrylate or PMMA optic of the device project through the opening and that is created in the upper eyelid. So here you can see this is how it is created. So here this is how it is created, where the full tarsography is made and only the optic part is visible, but other parts are not visible. So this kind of process is indicated for those people who are having severe ocular surface disease. So the device in this photograph, which are placed in patient with severe ocular cicatricial pemphigoid. Here, this is the part. So here, this kind of case like severe Johnson syndrome or ocular cicatricial pemphigoid. So here, is to save the ocular surface as well as to give the patient good vision. So here only the optic part is visible and other things are done by the full tarsography. So that's all, friends. Thanks for watching, and please don't forget to like my video and subscribe to my channel. I hope this video helped you a lot in understanding about keratoprosthesis. So here today we discussed about this Boston keratoprosthesis. That is the most popular type of keratoprosthesis that is performed in multiple OPTs. Okay, and it actually give very much satisfactory result in every patient. Most of the patient get very much significant visual improvement, where the penetrating keratoplasty is failed multiple times and the patient want to get the vision. So here this can be a very good option. Thank you so much for your kind listening.